Let's talk about something that might sound boring, but is honestly super important if you live in Australia. Health insurance. Now, I know what you might be thinking. I'm young, I'm healthy. Do I even need this? Trust me, I used to think the same thing. But here's the thing, life can throw curveballs. And in Australia, there are some unique things about how health insurance works that are actually worth knowing, especially for young adults. First up, Medicare. This is Australia's public health insurance system, and honestly, it's one of the best parts of living here. If you're an Australian citizen or a permanent resident, you're probably already covered. Medicare pays for things like doctor visits, specialist appointments, hospital stays in a public hospital, and even some prescription medicines. You just swipe your Medicare card, and most of the bill is covered depending on your situation. But here's what Medicare doesn't always cover, like dental, physio, optical, or private hospital rooms. That's where private health insurance comes in. Private health insurance is basically a way to get extra cover on top of Medicare. There are two main types, hospital cover and extras cover. Hospital cover lets you choose your doctor, skip some of those long public hospital wait times, and get treated as a private patient in a public or private hospital. So if you ever need surgery or something major, you might have more say in how and when it happens. Then there's extras cover. This is for services Medicare usually doesn't cover, like dentists, new glasses, physio, and even massages. If you're always at the dentist or you need contacts, extras can save you some serious cash. Now, why would you even bother with private health insurance if Medicare is so good? Well, besides the extra cover, there's also something called the lifetime health cover loading. Basically, if you wait until after you turn 30 to get private hospital cover, you could end up paying more for it later on. Plus, if you earn over a certain amount, private health insurance can actually help you avoid paying extra tax. But don't worry, you don't have to sign up for the most expensive plan. There are heaps of options, depending on whether you just want hospital, just extras, or a combo. It all comes down to your lifestyle and what you care about. So, if you're young and healthy, you might go with a basic plan just so you're covered if something unexpected happens. Or if you love your dental and optical, extras might be your thing. At the end of the day, health insurance in Australia is all about choice. Medicare's your safety net, and private insurance lets you personalise your cover. Take a minute to think about what works for you.